James Evans.
Presiding Officer, I'd like to thank you, Minister, for mentioning my mental health bill, and I won't be talking about that today. Another issue which I think is really, really important is body dysmorphia, and the amount of young people across Wales who actually are suffering with body dysmorphia, and the amount of false images that we're seeing across social media platforms, whether that's Facebook, Instagram and TikTok. You've got young girls now asking for more and more cosmetic surgery to alter their images. You've got young men going to gyms, which is damaging their development, all in this pursuit of looking perfect, whatever perfect is supposed to look like. We need to address this very, very quickly. There was a bill going through Westminster which is about digitally altered images. I know that isn't in your portfolio. But what I'm interested to learn is, what is the Welsh Government doing, Minister, to help people with body dysmorphia, to try and actually put strategies in place and support the third sector as well, who can actually help our young people across Wales? Because if we don't get on top of this issue, we're going to have more and more young people altering their appearance through cosmetic reasons and under the knife at a young age, which is going to damage their mental health for years and years to come. It's a huge issue, and I'd love to know what the Welsh Government is doing to address this very real problem in our young people across Wales.
Absolutely. Thank you, James Evans. And I think it kind of touches on what I said to Hannah Blythen in my previous response, that that is one of the key stressors for young people and impacting their mental health and well-being, is that kind of, it is the bullying and the targeting online, but it's also just the kind of like constantly being targeted by, you know, companies that do not care about their mental health or well-being. You did talk about the bills that were going through, or getting ready to go through in Westminster. I will absolutely speak to my counterparts in Westminster to see where we are with those, because I think there was a lot of good work in there, and a lot of clinicians and third sector had actually input into them. I would say as well that I think it's really important, and I think that the Welsh Government has demonstrated this, that when we're talking about like the healthy weight, healthy Wales, that we're also very cautious about what we're putting out there as well in terms of the messaging. And I think we've had a number of debates, you know, over the last few years, where it's been about ensuring that we're listening to everybody's voice and not sometimes just like the loudest voice. I also think that when it comes to body dysmorphia, there's kind of a crossover with ARFID, which is something that I know that you and I are both very aware of. And I wanted to say that there is now a programme that's being looked at for the specialist, for an Iron Bevan, who are kind of like doing a pilot of this, which I think is really important. So we are trying to really, you know, kind of like be more open to the different pressures that people are having and the different, because it wasn't always like that. I don't think people understood. So specifically in terms of body dysmorphia, I do think that it's about the messages that are coming through in school and the programs that we have. I think it's about ensuring that when we have the in-reaching CAMs, the people who are providing that support are very aware of it. I think in terms of the online and the digital and the targeting, that is monolithic, and I think that probably will require legislation, and I think that will require something at UK level. So I will always ensure that it's the forefront of my mind. And I guess as well, really, I'm on social media quite a bit, and I see all of these, and you can get sucked into using those. You know, I know people use like the Facetune apps, and then it's very hard to look at your own face again, you know, when you've seen it with filters all the time. But what I would say as well is that I really appreciate people who speak out about when they've had some of these procedures and they've gone very wrong. And I'm seeing a lot of that now as well, where people are going abroad and they're actually really regretting it afterwards. And I think that that's becoming more prevalent, and that's probably a lot more of what we need to see as well. So thank you.